All right, welcome back. As you all know, the World Health Organization has declared the Zika virus and its suspected links to birth defect now a global public health emergency, signaling the seriousness of the outbreak of the virus. 23 countries are now thought to have been affected by the outbreak of the virus, which was detected in Brazil. Almost all the countries affected are in Latin America. The United States of America recently announced its first set of cases in the state of Florida, where a state of emergency was placed on 4 counties where 9 people were diagnosed with the virus. Now, why is the Zika virus considered a serious health issue? Well, it's because scientists are suspecting a possible link to microcephaly, a condition that causes babies to be born with unusually small heads and, in most cases, damaged brains. Cases of microcephaly are rising in Brazil, which is considered the ground zero for the disease, though there's still no conclusive medical evidence yet that Zika causes the condition. Nigeria's Health Minister, Professor Isaac Adewale, says there's no single case of Zika virus in the country, but the fact is that Nigeria is very vulnerable because the species of mosquito that carries the virus are present in Nigeria. Besides, the very first human case of the Zika virus was registered here in Nigeria way back in 1968. At the moment, there's no vaccine for the virus, and we all know our environment here is mosquito infested. Joining me now to talk more on this is one of Nigeria's foremost virologists, Professor Sunday Omilabu of the University of Lagos Teaching Hospital, Lutz. Professor, thank you very much for joining us on the program. Let me just start by asking you, just how vulnerable is Nigeria to the Zika virus infection?
As I mentioned in one of our discussions earlier on Zika, we know that the vectors that carry Zika virus, they are found here. The mosquitoes called Aedes aegypti, Aedes africanus, they are all commoner here. And apart from Zika virus, they carry other viruses, notably yellow fever virus, dengue virus, and a host of others, even West Nile virus. So the vectors are here, and once the vectors are here, the possibility of having the virus being around is also very, very high. As we mentioned earlier on, in the 70s, human strains were isolated in Nigeria. And there are evidences of the activities of Zika virus in a number of domestic animals in Nigeria. And that affirms the fact that the vectors are around us. And they are still very much around us. We all have mosquitoes that we share our apartments with.
Now, Prof, let me ask you, because one of the reasons why this disease is considered a serious health issue is just because of the fact that it affects unborn babies when pregnant women get infected. For our pregnant mothers here, just how dangerous is this for them? I mean, you know, especially when you look at the cases of microcephaly in Latin America.
If I get you well right, the virus causes more deformation on fetuses, and this is not far-fetched because the fetuses they don't have immunity to fight the virus while inside the womb. So it is expected not only Zika, any other virus that gets into the fetus in the womb of the mother will be equally infected. The Zika is one of those viruses that they know once it passes into the fetus through the placenta, will infect the fetus. The antibodies to the virus in an individual is expected to wage war against the virus. But the fear now should be in those women of childbearing age that don't have immunity. Immunity that we know, especially against flaviviruses, they have a lot of cross-reacting antibodies, which is expected to eliminate the virus in adults. So in Nigeria, we don't expect much of these teratogenic effects in pregnant women, because we know a number of Nigerians carry antibodies to a number of flaviviruses.
Please, can you just help us understand these antibodies you're talking about? Can you just explain it for people to actually understand what you mean by antibodies? Because it's very important and critical.
These are the body fluids that are in the blood. They are the body soldiers fighting all foreigners, including viruses, parasites, and name them. And these antibodies are kept in the body to look for foreigners, the scavengers. They look for foreigners and trap them and eliminate them from the body. If any virus, such as Zika, should come into contact with these antibodies, and the antibodies will be there waiting to look for the type of Zika, bind onto the Zika, and then make it immobilized, and is eliminated from the body. So we expect these among Nigerians that have been exposed years back to Zika virus. So they have antibodies. And aside that, majority of Nigerians, the elderly, we have one time or the other took a yellow fever vaccine. And this vaccine is expected to raise the level of our immunity against yellow fever virus and a good number of other flaviviruses, including Zika.
But despite what you're saying now, it still does not mean that there's no chance that a pregnant woman in Nigeria may not come down with this microcephaly issue when they're pregnant.
Scientifically, it is expected that anybody with hard immunity to Zika and other flaviviruses will not come down with Zika virus infection.
Now, Prof, can you just help us understand just how does one avoid this disease, this infection now? Because, for instance, we're hearing that it's not just mosquitoes now. In the United States, there's this rare case of sexual, the virus getting transmitted through sex. Yeah. And that is quite worrying and scary.
Yeah, sexual transmission is possible for all blood-carrying agents, including Zika virus, human immunodeficiency virus, hepatitis B virus, hepatitis C virus, as long as they are transmitted through blood. So while having intercourse, there might be abrasion, so there might be wounds. So once you have wounds, the blood are bound to be exchanged. And any blood carrying the virus can easily be exchanged among partners. So that one is expected.
For us in Nigeria, what exactly do we need to begin to do now to avoid any outbreak of the Zika virus disease here? Because we know that we're having a serious challenge with dealing with Lassa fever. Not long ago, we dealt with Ebola and now Zika. What exactly should we be doing to avoid it?
Thank you very much. Zika like yellow fever, dengue, West Nile viruses, they are equally transmitted by mosquitoes. And we need to wage war, serious war against these mosquitoes. We shouldn't allow them to populate around us. We should destroy all their breeding spots. And we know all these breeding spots. All our used water, tires that carry water, these are good medium where the eggs germinate. And once you have this type of potholes around us, they serve as good breeding places for a number of these mosquitoes that carry not only even Zika, they carry other viruses, as well as even malaria parasites.
Well, the reason I asked you that question is because I haven't seen any kind of action now from either the state, federal, or even local government areas, fumigating communities. Let's take Lagos, for instance. We know there are communities in Lagos that are mosquito infested, heavily infested with mosquitoes. We've not seen any deliberate effort at all to fumigate these areas and try to destroy the mosquitoes.
Yeah, I think that's what our governments need to put in place. So they have to destroy all those depots of mosquitoes. They have to destroy all their eggs and larvae where they are being stored. So we have to wage total war against mosquitoes. And you can see all those bushes around us also harbor these mosquitoes. So we should make sure that our environments are clean enough not to harbor mosquitoes. Mosquitoes, once we see mosquitoes, they are our enemies. They carry a lot of deadly viruses. It's only Zika that we are talking now. We don't talk of yellow fever virus. We don't talk of dengue viruses. We don't talk of chikungunya viruses. We don't talk of West Nile viruses. They are all carried by these mosquitoes. And they all result in disease of human beings.
Prof, let me ask you something very worrying. Do we have facilities in this country to diagnose Zika?
For the diagnosis, we use tissue culture to isolate the virus. We use mice to isolate the virus when we were doing active arbovirus work. So it's very easy to diagnose. And of course, we use a PCR, which we are using for Ebola, for Lassa, for a number of viruses now. We also use it for Lassa fever, Zika virus diagnosis.
But one very big issue is that we understand it's difficult to know when someone is infected until the symptoms begin to appear. So that is a problem, isn't it?
It usually presents with febrile illness. If we take the issue of healthcare facilities serious, anybody with febrile illness should take himself or herself to the doctor, let them check him, take the blood samples, and then we can do the diagnosis. We can check.
One other thing, Prof, I have to ask you. There are also chances of getting it wrong because, we're talking about a country like Nigeria where the moment an individual comes down with anything like fever, the first thing that individual does is just to go to a nearby medicine store, a chemist as we call them here, and just order for anti-malaria drugs. That could also be a problem.
Yeah, it is a problem, but in case of pregnant women, the pregnant woman with febrile illness should meet a doctor fast to eliminate a Zika viral infection. In the light of the fact that we know that if the virus should get into the body, it moves straight into it targets the fetus. And the fetus, as we know, lacks immunity to fight the virus.
And of course, there's no vaccine for Zika at the moment.
No vaccine yet. No vaccine yet.
So, Prof, let me just quickly ask you, what would be your last word on the Zika virus? What exactly would you be telling Nigerians and what should they be doing now? And just how serious is this?
Nigerians should calm down. We've had Zika virus in the past. As we are talking, we having some mosquitoes biting us. We don't know what they are really pushing into our body. And like I mentioned earlier on, once we wage war against mosquitoes, we don't allow them to bite us. We fight them with all our strength. We make sure that our environments are left clean. We sure mosquitoes will not carry the virus to us. We make sure we protect ourselves against mosquito bites. In all our houses, in all our offices, we have to make sure we fleet insecticides. The original insecticides that we kill all these mosquitoes around us. Once we have this in place, you don't have any case to worry. And as elderly ones, we have enough antibodies to fight Zika virus.
Finally, Prof, before I let you go, just one more question. These antibodies you're talking about, how come in Brazil it's not the case? I'm pregnant. Elderly people there would seem not to have the antibodies.
You know, they mentioned with Brazil and US, the virus is of problem for the pregnant woman. The pregnant woman who doesn't have enough antibodies to fight this virus, the virus will now move straight and target the fetus it's carrying. And we know that the fetus lack antibodies or defensive mechanism to protect itself against the virus infection. And the virus will use such a fetus as a breeding vessel just to repopulate itself, and in addition, in effect, will destroy the fetal tissues. It's not a problem for adults. Adults have antibodies to fight it. It is only the poor fetus that doesn't have antibodies or defense soldiers to protect itself against Zika virus.
Prof, why do we keep having all these, problems coming up, viruses here and there? We just dealt with Ebola. The world is still dealing with Ebola, as a matter of fact. Then there was Lassa fever. We're still dealing with that. And now Zika virus. Why do we keep having all of this?
Yes, it's normal. We know that we're going to be having what is called re-emerging viral diseases, as well as emerging, which are newly discovered. It is expected. You know, there's a lot of urbanization now. We are now encroaching into what used to be the habitat of a number of these mosquitoes. So where you used to have these mosquitoes, initially they were in the forest. You know, Zika forest used to be in Uganda, where the first isolates were made in 1949. So most of the forests are now occupied. They are now urbanized. You now have cities there. You have people there. So we are now sharing our environment with the mosquitoes. And as long as we do this, we tend to have a number of newly discovered viruses. And of course, with Zika, we know it's re-emerging, especially in African countries that have reported Zika before. It's re-emerging maybe because we are now looking for it. And if you don't look for it, you will not say it is there. It is only when you now look for it that you now know that, okay, so I'm sharing my environment with these viruses. So it is bound to be so. We're going to be having emerging viral diseases, those that have been discovered, as well as re-emerging, those that were there before, but we now have improvement on our diagnostics. So we'll be having them. To us as virologists, this is not nothing new. It's what has been theorized.
Professor Sandu Milabu of the University of Lagos Teaching Hospital, thank you very much for joining us on the program. Well, that's it on the program this week. If you want to watch it again, it's simple. Just go to our website, tv360nigeria.com. You'll find the program and lots more there. You can also watch us on YouTube by subscribing to our YouTube channel. That's youtube.com/TV360 Nigeria. Do subscribe to get latest videos and updates, or just follow us on Google Plus at TV360 Nigeria, or like us on Facebook. The address is facebook.com/TV360 online. You can also follow us on Twitter. Our handle is at TV360 online. Thank you very much once again for watching. We'll see you next week.